Okay, well, it is now time to start our webcast. Welcome, everybody. For those of you who are joining, feel free if you want to tell us where you're from and in the chat box. You can always tell us where city and state you're from. But I am Edward Shin. I am the CEO, co-founder of Quality Reviews. And for those of you who don't know what we do, we help healthcare providers collect real-time feedback from patients really for the purposes of improving experience. And today it is my pleasure to welcome Dr. Alan Copperman to our live webcast. And Dr. Copperman is the medical director of RMA of New York. And he's also the director of the Division of Reproductive Endocrinology and Infertility, as well as the vice chairman of the Department of Obstetrics and Gynecology at Mount Sinai Health System and the medical school there. So Dr. Copperman, welcome so much. It's great to see you.
Great to see you too, Ed, and really a privilege to be here today.
And one thing I wanted to add also, in the spirit of full disclosure, Dr. Copperman was also our provider when Jenny, my wife, and I were on our fertility journey. So I have a rather close relationship with Dr. Copperman as well. So I just want to let everyone know of our experience with you personally. So as mentioned, I really just want to dive right into it. This is obviously an unusual, challenging year for everybody. And I can't imagine if you're a couple or a woman trying to conceive how it must be in, IVF journey in the time of COVID. So, can you just provide a little overview of how it's been, providing IVF and fertility solutions to your patients in this year?
Sure, 2020 has given us a run for our money. In February and March, we began to hear early stories and had our first cases. And then New York got hit, and it got hit hard. Just the sirens 24/7 going down the streets, and then the streets being empty as we were in lockdown. And then one day, actually coming home from work and hearing people clapping at 7 o'clock and out their windows clanging pans. And of course, I started to applaud because the people, these frontline doctors, these emergency room doctors, these pulmonologists, these respiratory care therapists were risking their life. We knew so little about the virus, and people were really putting themselves, some medical professionals and healthcare professionals were putting themselves out there in a way that we had only heard about in history books or watched on movies about wartime, and we suddenly were in the middle of a war zone. And then we closed for a little while or took a pause on IVF. And as we opened up, I realized that we had to applaud our colleagues in the field of reproductive medicine because having babies is an essential reproductive service that we need to provide to our patients. And our frontline employees and our embryologists and our nurses and our phlebotomists were the first ones back as we began to reopen. And at 7 o'clock, I clapped for them as well. So the field has been on quite a journey over the last 8 months, and we continue to be facing unprecedented challenges as people, as healthcare professionals, as members of the reproductive community, and it's forcing us to innovate to be safe.
Yeah, no, absolutely. Diving into a little bit more detail, tell us a little bit, when the pandemic first hit, you mentioned that your practice went on pause. How did that affect patients who are, kind of in the middle of their stimulation or in the middle of their journey? Tell us how you navigated the complexities of that.
We did not interrupt anybody's treatment cycles. If they were in a treatment cycle, they had started injectable medications prior to an egg retrieval, for example, we had them finish their cycle. We stayed open for that, but we paused because we really did not fully understand transmission. We were worried about putting our patients at risk, our colleagues at risk. So for a month, in the month of April, we stopped doing egg retrievals and embryo transfers, but patients were put on the birth control pill. They were asked to wait a month. They stayed home. So we saw consultations, and we also made a tremendous transition to a Zoom field. So we began telehealth, and we could talk to patients, review medical records, establish protocols, We would send them saliva kits to do genetic testing to see if they were a carrier couple at risk of having an unhealthy baby. We would, there were some at-home semen analysis kits. So we would work with them on timing ovulation so that they can maximize an attempt at home. So we just made a transition, I think, as practitioners and as a field.
Yeah, no, that's good. That's fascinating. And would love to ask a little bit more detail about some of the at-home care that you provided. But before I do that, so when you reopened